So guys, welcome to the session. I hope I am clearly audible and visible to all. Clearly audible and visible to all. So here we are for discussion, and this is Dr. Vishwajeet Singh, your faculty for Forensic Medicine and Toxicology subject in DBMCI. And we will be discussing our FMT subject questions. So first of all, we will cover our morning session questions, and thereafter evening session in this continued session itself. Uh, Very good morning to all. Greetings to all. Clearly audible and visible. So let us start with our session. We are good to go. All of you can put your inputs in the live chat window. If there is any correction to be made, I will make a note of it and I will be improvising the inputs given by you all. So inputs are welcome. Don't hesitate in giving your inputs. I hope the paper was a balanced paper as far as all the subjects are concerned. From FMT, you got about round about 12 questions in each sessions. So let us start with our first question. This was one of the question in a gunshot case, and it was a simple question. In a gunshot case, tattooing is noted surrounding a firearm entry wound. This tattooing occurs mainly due to, and you are given four options. And yes, we know heat or fire effect will lead to. This will lead to singeing, na? So the correct answer here goes with unburnt gunpowder particles, without any doubt. Without any doubt. And this heat or fire effect, flame leads to singeing. We all know. Unburned gunpowder particles, they lead to tattooing, and the black smoke particles, they lead to blackening of epidermis. So these are the three effects which we get whenever a firearm weapon is fired. The three effects in the form of flame effect, smoke effect, and unburned gunpowder particles effect, leading to singeing, blackening, and tattooing. Maximum range is for tattooing, medium range is for blackening, and a very small range is for singeing, that is flame. Correct now? Let us move on to next question. This was another question. Spanish windlass technique, a type of mechanical asphyxia, is also known as which type of strangulation? And yes, we have covered in our classes, in our DBMCI classes, that yes, the correct answer here goes with garroting and nothing else. Garroting is strangulation by iron collars. This is what we learn in our classes now. Strangulation of a person by iron collars is referred to as garroting. And one of the types of garroting is Spanish windlass technique. Correct? Without any doubt. This was a straightforward question. Then Barnes-Dola is strangulation by bamboo sticks. Mugging is strangulation by bend of elbow or by bend of knee or by sole of foot. And throttling is manual strangulation. Okay, so basically the question was from types of strangulation deaths. And this similar topic was covered in our recent revision express videos too. Okay, with the help of this image we covered na, in the revision express videos that yes, this is the iron collar which leads to garroting. Garroting is by iron collars, and yes, this is a type of Spanish windlass technique. Another name used is Spanish windlass technique. Let us move on to next one. There were 4 to 5 match the following questions too, and match the following questions are bonus questions actually. Even if you are able to solve two of the columns, any two things, you are in a position to solve the question. So match the following vegetable poisons with their active principles was asked in the exam. And in column A, one thing was given as Abrus purgatorius, and we know the active principle in Abrus purgatorius is abrin. Active principle in the seeds of Ratti. Abrus purgatoris is called Ratti or Gunchi. Then active principle in Nux vomica or Strychnus nux vomica is strychnine, brucin or loganin. Along with brucin, remember strychnine as well as loganin. These are the active principles in strychnine seed. And this was covered in one of the 5 images was Nux vomica seeds where I covered all the active principles. Isn't it? Then Dhatura active principle, we all know the active principle in Dhatura seeds is atropine, hyoscyamin, hyoscyamin. And opium consists of natural opioids like morphine, codeine, and thebaine. We all know these are the 3 natural opioids: morphine, codeine, and thebaine, MCT. So this is a straightforward match the following. 1, 2, 3, 4. Option D goes as your correct answer without any doubt. Okay. Till here the questions, all the questions were simple questions from the subject of FMT na, and it was very good thing from a student point of view. All the questions were solvable questions. Let us move on to next one. And this is your 5 image na, image number 35, which I included in the form of strychnus seeds, where we covered the active principles in total, all the important active principles. And this was the question. So almost all the questions from FM were covered in DBMCI and eGurukul. Okay, let us move on to next one. Yes, easy peasy. Life should be easy peasy. Question should be like this, that our life becomes easy peasy. And we keep on smiling. We have a good smile on our face. Chal. Now, this was one of the questions, which was not tough. The options made it very simple. The options made it very simple. It could have been made a tough question. But the examiner thought that let me create a very, very simple question. So dead body of a child was recovered from near a river with froth over mouth. Something was shown in the image in the form of a froth. And they particularly mentioned that this froth reappears even after wiping. Means all the airways, they are filled with this frothy material. That is why when you will wipe the airways, that is mouth and nose, the froth is coming from the deeper airways. That means the respiratory zones consisting of terminal bronchioles, alveoli, they are filled with this frothy material. Correct? So this goes with antemortem drowning because the person was respiring. The water went into deeper airways. So basically, they asked the question that which of the following post-mortem findings is not seen? Is ballooning seen? Yes, ballooning is seen. Can cadaveric spasm be noted? Yes, this is the surest sign of antemortem drowning. Cadaveric spasm due to struggle. The person consumes the ATPs of hand muscles and they go into permanent contraction. So yes, cadaveric spasm with mud in the closed fist can be seen. Can pulse hemorrhage be seen? Yes, we have covered in our classes now that 50% of wet drowning cases, 50% of wet drowning cases, they can present with subpleural hemorrhages in lungs, mainly involving the lower lobes, called as pulse hemorrhage. So we know all this, and yes, out of exclusion, the answer becomes arsenic from hair sample is anyway not related to this case. Even a layman will solve this question, isn't it? Correct? I hope there is. What do you mean by ballooning of lungs? This should be very clear. Like what happens now? Ballooning of lungs means, suppose this is the person whose autopsy was being done. Okay. This is the person whose autopsy was being done and the person is lying over the dissection table. We have removed the sternum. We have removed the sternum bone. Now the thoracic cavity is open for me. Now what I'm seeing is the moment I remove the sternum, the lungs balloons out. In a case of wet drowning, why? Why this happens? Why lung ballooning occurs? Because of the simple fact that this froth, which is present in our airways, in fact deeper airways, this acts as one-way valve mechanism. It acts as one-way valve, means it will allow the air to come inside, but it won't allow the air to go out. So in a case of antemortem wet drowning, what is the scenario? The person is taking water in the airways. At that time, he is respiring too. So water is going in the airways, but it is not able to come out. Why? Because the froth is acting as a one-way valve. And this in totality gives rise to ballooning of lungs, over distension of lungs. Correct? So remember this simple thing. Simple, but to be remembered, to be understood. So this was again a simple question. Let us move ahead. Now, finally, forensic odontology was asked. Forensic odontology was asked. And it again was a simple question, isn't it? What will be the correct answer to this out of these options? Try to solve it. Match the following teeth eruptions. Permanent teeth was given in one column and age of eruption in another column. The correct answer goes with first molar is the first permanent teeth to erupt at the age of 6 years. This we know now. And yes, these eruptions, they have got a range. Na? It is not all or none phenomena that at 6 years molar 1 will erupt in every person. So it has a range. It is variable from person to person. This we know. But in total 6 years. So molar 1 goes with 6 years. So I can write 1 over here. I can write just a minute. I can write 1 over here. Then we know the mnemonic na. Whenever mummy is in pain. Whenever mummy is in pain. And the question was basically related to this mnemonic. Your papa can make medicine. Can make medicine. And we have learned in our classes now that this mummy stands for molar 1, is for central incisor, in for lateral incisor, pain for premolar 1, another papa for premolar 2, can for canine, make for molar 2, and medicine for molar 3. And we remember that yes, 6, 7, go on increasing the numbers by 1, and you can recall all the ages. So if you remember this simple mnemonic, the question was based on this simple mnemonic, isn't it? Now try to apply this mnemonic in the question. First molar 6 to 7 years, then canines roughly 11 years, 11 to 12. I can put number 3 over here. Lateral incisors I know about 8 years, so I can put number 2 over here. Third molars 17 to 25. So 3214 is my correct answer. Option D goes as my correct answer. This was also a simple question. The application of that simple mnemonic, mummy is in pain. Whenever mummy is in pain, papa can make medicine, is able to help us remember the age of eruption of all the permanent teeth in a simple way. Chalo, आगे बढ़े. Let us move on. So easy, so easy. Paper ऐसा ही होना चाहिए, easy होना चाहिए, isn't it? So that we keep on smiling and smiling. Which of the following is not a cardiotoxic? Which of the following is not a cardiotoxic or cardiac toxin? This I used to tell time and again. Na? In all our classes, we have learned that yes, this is a very important topic, the list of cardiac toxins. And we have remembered a mnemonic also no? For this. Every dawn has a queen. So the mnemonics which make a protein has for hydrogen cyanide, A for aconite, A for aconite, and queen for quinine. Quinine. And oleanders are yellow color oleanders, where the flowers are yellow colored. They are called Cerebra thibatia. And we have white and pink color flowers. That plant of oleander is called Nerium odorum. So this question was based on the differentials of cardiotoxic poisons. So answer goes with Atropa belladonna. Correct na? Simple question. Itna easy question not expected. Yes, correct. Correct. INI-CET mein it was totally unexpected. That is correct. Now this was again a simple question, easy question. इसको tough बनाया जा सकता था but नहीं बनाया गया. It could have been made tough but it wasn't, thankfully. So correct answer here goes with RIL. What is the question? A patient with history of previous surgery comes to hospital with abdominal pain and fever. X-ray abdomen was taken and finding is given below. What you are noticing in the abdominal cavity or peritoneal cavity? A scissor which has been left by the surgeon in the previous surgery. What is this? Even a layman will say that the doctor is negligent. So the layman will say, yes, obvious fault has been done by a doctor. Whenever obvious fault, which can be seen even by a non-medico, and it has been done by a doctor, which doctrine is applicable? Doctrine of res ipsa loquitur, also called as RIL. What is the scenario in RIL? When the matter will go to courts, the case will be like state versus doctor. The doctor is the accused who has done this obvious fault. Now the burden of proof. Next time, future exam questions. उसको भी तो ध्यान में रखना है ना. Upcoming NEET PG tentatively on 5th of March. So next time they can ask you, burden of proof regarding innocence in RIL cases lies on whom? Normally we know, as per our Indian legal system, the burden of proof lies on the victim side or the state side, representing the victim. But here the burden of proof regarding innocence will shift on the doctor. Why? Because RIL says the facts of the case, they speak for the patient. This is what is RIL. Then res judicata we all know. No one can be doubly jeopardized for the same offense. Novus actus interveniens is another sort of defense for we doctors, that for unrelated action intervening the chain of causation, the doctor cannot be held responsible. It is taken as act of God. And vicarious liability, also called as respondent superior or captain of ship doctrine or doctrine of deep pockets, basically makes employer also responsible for the negligence of employees if there is an employer-employee relationship. Correct now? So the correct answer here goes with RIL. Chalo. And this we covered in our classes too. Like I will show you. This we covered in our revision express videos too. All these important aspects. Because with experience now we come to know that yes, all the cardiac poisons differentials are very important. These doctrines, which are exceptions of Indian legal system like contributory negligence and RIL, they are all time very important. Kindergarten question. Chalo. Very good. Now this was a question which some students are saying it was abrasion, some are saying contusion. And this I covered in one of the Vive questions because I was sure that you will get multiple questions from injuries topic, which I told in the Vive session too. So finding in the image given below, the major injury being shown over here is this, and this is what is contusion for me, or I say bruise for me, without any doubt. Without any doubt. Abrasion कहां पर है इस इमेज में? मैंने वाइव वाले इमेज सेशन में भी बताया. Over here there is a small abrasion. What do you mean by abrasion? Damage of epidermis. If epidermis is intact and I am seeing a color change only, that goes with bruises. That goes with bruises. Abrasion नहीं था ना? चलो. So more number of students were of the opinion कि bruises था, and most likely a image sort of like this. I hope no question in this, no confusion in this. Okay. It was going with bruises or contusions. What is contusions? Rupture of soft tissue blood vessels, mainly arterioles, venules, and veins. And what happens? They rupture. So there is rupture of hemoglobin pigment. Initially it is oxyhemoglobin, then deoxyhemoglobin, and so the color changes are noted in the bruise. And this was your image number 9 in the Vive. A sort of this question was already predicted, and yes, it came in the exams. And this was covered in the revision express videos too, that yes, you will get questions from identification of abrasions and bruises. Okay. Chalo. Let us move it. Now this was a question which is this was a question which was very simple. Again, they gave everything in the question as per the recalls by the students, that a 70-year-old lady presents to emergency department with increasing somnolence and lethargy. Multiple things were written. 1 kilometer long question. Her symptoms developed on the day of admission. Her symptoms, there was history of fall. NCCT demonstrate crescent shape. The moment you see this crescent shaped hyperdensity or concavo-convex appearance on NCCT, think towards SDH on CT. And yes, the hemorrhage is crossing the suture line, something like this was given, and the patient eventually died after a few days. The autopsy finding was shown in the image, and you were asked what is this hemorrhage. The answer goes with yes. What is the most common cause of SDH? Suppose the question was what is the most common etiology for this hemorrhage? Yes, the most common etiology for SDH is rupture of subdural bridging veins. It is most commonly due to SDH is most commonly due to rupture of bridging veins. Without any doubt. Suppose this was the option. This some students told me that yes, this was in the option that they asked the cause. Nevertheless, if they ask the cause, you are in a position to solve the question. You have made your diagnosis. It is going towards SDH. What is the most common cause of EDH? Rupture of middle meningeal artery. What is the most common cause of SH? Trauma. Preferred as an answer of a rupture of intracranial berry or saccular aneurysm. What is the most common cause of intracerebral or intraparenchymal hemorrhage? Hypertension. Hypertension. Which artery is most commonly involved there? Middle cerebral artery. These are pet questions. Now, this was more correlated with pharma, and this we cover in our general toxicology, management aspect of toxicology in general. There I cover this topic, that alkalinization of urine leads to excretion of, increased excretion of, yes, weak acidic drugs will be the best answer of choice. Why? Because we know that weak acidic drugs, they ionize more and reabsorbed less. In which medium? Alkaline medium. This fact we know now. In alkaline medium. And why not strong acidic drugs? Because this alkalinization of urine will be helpful for only weak acidic drugs which have a pK between 5 to 8. It is not used for strong acidic drugs. This won't be beneficial. Okay? So this was again, and what is the list of weaker acidic drugs? Can be asked in your upcoming NEET PG exams. So the mnemonic is MNS, M for methotrexate, N for NSAIDs, S for sulfonamides, blood pressure, B for barbiturates, P for penicillin, and C for chlorpropamide. These are our mildly acidic drugs. Methotrexate, NSAIDs, sulfonamides, barbiturates. Important barbiturate agent, that is phenobarbital, then penicillins and chlorpropamide. Correct me? Then another question of your session 1, morning session, was related to scorpions. This was a trappy question. Some of you got trapped, I think. If the lines of the question were exactly like this is what they were asking. If they were asking antidote of choice, my answer goes with option C. Because all these are symptomatic managements. All these are symptomatic managements or conservative managements. Based on the symptoms, you will be giving prazosin. Now, how to attempt such questions? See, a scorpion sting, or we say due to the sting, venom of the scorpion will be going inside the body of the victim. Now, this venom acts on autonomic nervous system. This is what I have taught you now. And by its action on autonomic nervous system, it has a tendency to stimulate sympathetic system first, followed by parasympathetic system. So initially the person will be hypertensive, for which we can give prazosin. But later on the person can show you hypotensive features, for which we have to give dopamine. The patient can show you pulmonary edema features. Yes, that is also a features due to venom activity, for which we can give diuretics like furosemide. But what will be the antidote treatment of choice? This venom will be countered only by scorpion antivenom. Scorpion antivenom. And what is the dose preferred? 1 vial. 1 vial. For snake bite, we give 8 to 10 vials na initial dose. Here 1 vial is enough. Drug of choice for scorpion poisoning or option C तो था ही नहीं. BP was normal. Drug of choice था. Antidote नहीं था. Antidote नहीं था तब तो फिर क्या था कि initial management of choice. Initial management of such a case. Something like this. इनिशियल मैनेजमेंट, अगर हाइपोटेंशन नहीं था, अगर मान लो ये फीचर्स को मैं एब्सेंट ले लूं एंड क्वेश्चन है कि इनिशियल मैनेजमेंट ऑफ चॉइस टू स्टेबलाइज द पेशेंट, समथिंग लाइक दिस, देन यू कैन गो विथ prazosin because initially you get sympathetic overactivity, then you can go with prazosin. That is why I already told in the beginning, the exact question line what is being asked will shift your answer. If it is initial management of choice, yes, you can manage the case with prazosin. But yes, if they are asking treatment of choice or the agent of choice or the antidote of choice, it has to be scorpion antivenom. Give it as early as possible to counter the active venom, because this overactivity of sympathetic and parasympathetic activity will be countered only by giving antivenom. All these are symptomatic management. Correct ना? स्कॉर्पियन एंटीवेनम ऑप्शन में ही नहीं था. ये तो फिर बढ़िया क्वेश्चन हो गया. तब तो फिर थिंक गो विथ प्राजोसिन गिवन द लाइंस ऑफ द क्वेश्चन, क्योंकि इनिशियल system which is activated is sympathetic overactivity which will lead to hypertension. मान लो hypertension भी नहीं था, या this prazosin is effective to reduce pulmonary edema too, तो वहां भी यूज कर सकते हैं. इसीलिए बेस्ट आंसर गोज विथ प्राजोसिन. ठीक है, आगे बढ़े. I have taken the inputs, I have gathered the inputs given by you all. Thank you. सब सही हो रहा है ना. बीपी वॉज 108, मतलब नॉर्मल दिया हुआ था. बीपी वॉज 108/60, तो हाइपोटेंसिव है. अब देखो यहां पर कैच, अगर हाइपोटेंसिव है और साथ में पल्मोनरी एडिमा है, अगर मैं इसको मैनेज करने जाऊं तो हाइपोटेंशन को मैनेज कौन करेगा, और पल्मोनरी एडिमा को. बेस्ट आंसर नाउ गोज विथ फुरोसेमाइड ना. अगर केवल हाइपोटेंसिव टेंशन को मैनेज करना है तो डोपामिन इज वेरी इफेक्टिव. अब ये क्वेश्चन तो डाइसी हो गया. इसके मुझे इनपुट शेयर करना प्लीज, है ना, इन माय टेलीग्राम, और इसके इनपुट शेयर करना, whatever recalls you can make, so that we reach at the correct question what was being asked. अगर हाइपोटेंशन करके प्रेजेंटेशन है, मींस पैरासिम्पैथेटिक ओवर एक्टिविटी अगर क्वेश्चन में दिखा रहा है, तो प्राजोसिन नहीं मार्क करोगे ना वहां पर. सिंपल है. वी वोंट थिंक गो टुवर्ड्स प्राजोसिन, बट इफ द ब्लड प्रेशर वाज नॉर्मल देन यू कैन गो विथ प्राजोसिन. चलो नेक्स्ट क्वेश्चन. नाउ a 45-year-old female, and as predicted, this I told in the revision express videos too, as well as in vive sessions, that alcohol say you will get 1 or 2 questions, and this is the all-time favorite topic na. Sudden alcohol withdrawal at about 2 to 3 days, what will happen in the patient? And here the patient is having withdrawal symptoms and the person is in unconscious state, so we will give a IV drug, and the preferred one is oxazepam or lorazepam. So what are the preferred agents where liver is compromised? लिवर कॉम्प्रोमाइज करके दिया हुआ था ना, तो यहां पर ऑक्साजेपाम था ना ऑप्शन में. लास्ट ईयर एम्स का ही क्वेश्चन है, उसमें लोराजेपाम दिया हुआ था. तो ये पूरा लिस्ट याद रहना चाहिए हमें. दीज ड्रग्स ना, ट्रायाजोलाम, देन योर ऑक्साजेपाम, लोराजेपाम, और बताओ, और एक और बताओ. दीज आर सेफ ना फॉर लिवर, क्योंकि इसमें लिवर का मेटाबॉलिज्म होता ही नहीं है इन ड्रग्स का. इनका कॉन्जुगेशन होकर ये निकल जाते बाहर, तो दे आर सेफर. ट्रायाजोलाम, ऑक्साजेपाम, लोराजेपाम, ड्रग्स लाइक दिस. And the diagnosis here becomes delirium tremens. Diagnosis तो simple है, delirium tremens. Naloxone था ऑप्शन में. ओके, चलो ऑप्शंस करेक्ट करते हैं. Naloxone, हाँ, वेरी गुड थारंगिनी, यही मैं सुनना चाह रहा था. एस्टाजोलैम, तो ये हमारे ग्रुप ऑफ ड्रग्स है ना, टोल ग्रुप ऑफ ड्रग्स which are safe in liver. Alprazolam, midazolam, diazepam, oxazepam. So goes with oxazepam given this liver damage condition, or anything in relation to that LFT was abnormal or something like that. ये वाला फोरेंसिक साइकेट्री में कवर करते हैं ना, all the types of, and साइकेट्री में भी कवर करते हैं आप. This was a mixed up question. So all these impulsive behaviors were given in one column and you were to match what do they denote to. So dipsomania is yes, impulsive desire to consume excess of alcohol. Kleptomania is impulse to steal. This we know. This we know that this goes with 4. Pyromania is पूरी दुनिया में आग लगा दो. हर जगह आग लगा दो. So impulse to set everything on fire. Mutilomania is to mutilate. Yes. This was again a simple question. Option B goes as the correct answer. These are short acting ben short acting. S for short acting and toll for all the important drugs. हो गया पेपर वन. कितने सही हुए? ऑल करेक्ट होना चाहिए. होना चाहिए ऐसे पेपर में ना, ऑल करेक्ट होना चाहिए, एटलीस्ट फ्रॉम माई सब्जेक्ट, एंड दिस विल मेक मी वेरी हैप्पी. चल, अब FMT पेपर टू लेट अस डिस्कस द इवनिंग सेशन. शाम वाले लोग आ जाओ. Yes, God bless all such peoples. It wasn't a sadistic paper overall, na? So it is giving us relief. It wasn't a sadistic paper. चलो कोई बात नहीं. देखो एक दो रॉन्ग हो रहे, सिली मिस्टेक्स तो होते ही हैं. हाउ टू कर्टेल आवर सिली मिस्टेक्स? हमारा काम क्या है? वी हैव बीन गिवन लिमिटेड कैपेसिटी, हर ह्यूमन के पास उतना ही है. द मोर वी रिवाइज द लेसर सिली मिस्टेक्स आर. तो कीप ऑन रिवाइजिंग फॉर योर अपकमिंग नीट पीजी एग्जाम्स. अभी इस पे बॉदर नहीं करना है कि कितने गलत हो गए, क्या गलत हो. जो गलत हुए हैं दे शुड नॉट बी मेड रॉन्ग अगेन. दैट इज आवर अटेम्प्ट. वो हमारा होना चाहिए कॉन्फिडेंस कि नेक्स्ट टाइम आई वोंट मेक इट रॉन्ग. चलो अभी इवनिंग सेशन के क्वेश्चंस देख लेते हैं. दिस वाज अ अटर सिंपल क्वेश्चन. बेबी क्वेश्चन था. आइडेंटिफाई द फाइंडिंग इन द इमेज. This baby question was showing you prominent veins and they have given options like lividity, tattooing, ecchymosis. The correct answer goes with marbling. इसको तो डिस्कस करने का भी जरूरत नहीं है ना. This question does not need discussion. The moment you see prominent veins, with greenish discoloration means putrefaction. And what we should remember in relation to marbling, this is greenish discoloration of superficial veins, and the veins become prominent due to sulf-hemoglobin pigment, and this pigmentation this marbling process starts at 24 hours after death, and this process becomes visible. मतलब अगर मैं बोलूं कि ये दिख रहा है तो ये कब दिखना शुरू होता है? At about 36 to 48 hours due to sulf-hemoglobin pigment. चलो आगे बढ़े. लेट अस मूव इट. फिर से एक और बेबी क्वेश्चन. इन अ डेड बॉर्न फीटस. क्वेश्चन भी बेबी का एंड क्वेश्चन भी बेबी जैसे ही था. In a dead-born fetus case, gas was noted in aorta. But yes, if you have read the subject nicely now, all the FM questions were doable. Gas was noted in aorta during USG of the mother. Obviously, the mother will be pregnant. True about this is because the dead-born fetus का मतलब क्या होता है? Intrauterine death. The fetus has died inside uterus. So yes, this goes with Robert's sign. Ball sign क्या होता है? Due to hypermobility of the spine, the fetus assumes the shape of a ball. What is Spalding sign? Overriding of skull walled bones over each other. Frontal riding over parietal, parietal riding over temporal, like that. What is dual halo sign? Halo area or empty area between scalp and skull. All these are USG signs in a dead born fetus. चलो जी आगे बढ़े. इसमें तो कुछ और ये साइंस क्यों पूछे जाते हैं बार बार? बिकॉज दीज आर मेडिको लीगल साइंस. व्हाट इज द मेडिको लीगल इंपॉर्टेंस ऑफ दीज साइंस? दे हेल्प अस टू एस्टिमेट टाइम सिंस डेथ ऑफ दिस इंट्रायूट्राइन डेथ फीटस केस. डेड बॉर्न फीटस का कितनी देर पहले डेथ हुआ है कैसे बताएंगे? रॉबर्ट साइन इज अर्लीस्ट सीन एट अबाउट 12 आवर्स ऑफ डेथ. बॉल साइन एट अबाउट 2 to 3 days. Spalding at about 5 to 7 days. Dual halo sign at about 3 days. We are estimating time since death, and that is why these questions will be asked again and again. क्योंकि इनका इंपॉर्टेंस. फिर से आगे एक बेबी क्वेश्चन. ये हम पढ़ते थे ना क्लास में. कैसे पढ़ते थे? हाउ आई यूज्ड टू टीच. A bridge is there. A highly depressive person, not knowing the fact that India is rich in population, was depressed that his girlfriend has left him. इंडिया का पॉपुलेशन तो बहुत ज्यादा है, यहाँ तो ऐसे मैटर्स पे डिप्रेस होने की जरूरत ही नहीं है. बट दिस पर्सन वाज नॉट नोइंग द पॉपुलेशन ऑफ इंडिया. तो डिप्रेसिव नेचर में ये गया ब्रिज के ऊपर एंड ही फेल डाउन. He fell down in an attempt to commit suicide. He jumped from the bridge. There will be one scenario where he is between the bridge and the river. Another scenario is he has made an impact with the water. Third scenario is he is gone inside the water. What is this first scenario? For us, a dry drowning case. What is the most common cause of death in dry drowning? Due to fear of death, laryngospasm occurs and the person can die. So this cannot be my answer. What is this scenario? Where the person has made a contact with the cold water. This drowning in cold water is also called as hydrocution or immersion syndrome पढ़ा है ना हमने. And what is the cause of death here? This cold water stimulates the vagal nerve endings. And yes, the answer goes with vagal inhibition, or we say vagal shock. If the person has actually fallen in water and is doing respiration too, yes, the water will go, and depending on the medium of water, whether it is fresh water and salt water, he will die due to different causes. In fresh water, most commonly the cause of death is ventricular fibrillation. In salt water, a combination of acute pulmonary edema along with cardiac asystole. All these important cause, यही तो हम पढ़ते थे ना कि drowning का classification and most common cause of death of all these classifications is very important. And you got one question. It was again a baby question. ये वाला भी बेबी तो नहीं बोलेंगे, थोड़ा सा मॉडरेटली मॉडरेट क्वेश्चन बोल सकते. The following are laws of, ये repeat question है actually. This is a recent repeat of from INI-CET exam itself. The following are laws related to insanity. Pick the correct option as mentioned below in relation to laws of insanity. अब पहले तो पिक कर लो कि कौन कौन से laws of insanity है. Yes, we know Durham's rule, Curran's rule, Murphy's rule, false option. Ashley's rule से क्या निकालते हैं? We estimate the gender of a person or sex of a person from sternum bone. तो ये तो अलग ही चीज बताता है, तो यहाँ तो insanity से related है ही नहीं. So yes, option A goes as my correct answer. 1 and 2 are true. What are the other name tests? At least recall the names. Irresistible impulse test, New Hampshire doctrine, then your McNaughton's rule, then your Curran's rule, Durham's rule, and American Law Institute test. These are the most important laws of insanity in different countries. In India, we follow McNaughton's rule, which has been inculcated in our 84 IPC. Ashby or Ashley, something like that was in the option. So nevertheless, Murphy's and Ashley's, they are not rules of insanity. Durham's and Curran's goes as rules of insanity. And these are other rules. चलो, ये भी मैं चिक के बोलता था ना, कब जब fetal death topic पढ़ते कि this is a question which has been asked in FMG exams and it can be asked in any future exam. These were the exact lines, and it was asked in the INI-CET exam. Very good. So, cry of the fetus was heard by the doctor before delivery of the head. What is true about this? This goes with vaginitis uterinus. When the cry of the fetus is heard from uterine cavity, when the head is still inside uterus. Suppose it was given that the head was passing through vagina and the cry of the fetus was heard when it was still inside vaginal cavity. So that is what is called vaginitis vaginalis. Vaginitis vaginalis. आ गया ना question? So vaginitis word deals with cry. Uterinus determines the location of the head. बाकी other options तो false option है, infection of uterus vagina. आगे बढ़ते. ये वाला था बढ़िया question. And easy था. It was also a easy question. This was also a easy question. So what to do and what not to do, we have covered in our classes, in our DBMCI classes, eGurukul classes. So what to do as per snake bite management protocol? Multiple correct answers हो सकते हैं. सबसे पहला option, this was a funny option which was created, and why this option was created now I will tell you. You will come to know. Kill the snake. Now this is not to be done. Snake काट लेगा आपको and you will die. Never make an attempt to kill the snake. Leave it. ASB administration after admission. Yes, this has to be done. Immobilization as if the limb has fractured. This has to be done to prevent venomous spread. Debridement कभी नहीं करना है. Never make anything which will move the bitten limb. Like debridement. Tourniqueting नहीं करना है as per the guidelines. Washing नहीं करना है. अब ये guidelines किसने दिए? ये guidelines हमने पढ़ा है ना. This has been given by Ministry of Health and Family Welfare and followed all over India. So this is the protocol which from where they picked the question. And इस protocol के अगर मैं आपको extract दिखाऊं, if I show you the extract, This is one of the extracts of that guidelines, that important don'ts. So here they have written, do not attempt to kill or catch the snake. So they picked up option number A from here. And this may be dangerous now. This is a simple thing. Discard all the traditional first aid methods. Like previously people used to use snake stones, snake black stones are there, something like that. Then alternative medicine and herbal therapy. This is not to be used. Do not wash the wound. Do not interfere with the bite wound in the form of incision, suction, rubbing, tattooing, vigorous cleaning, massage, application of anything. Do not apply or inject ASV locally. ASV is to be injected through intravenous route, and slow IV injections are used. Do not tourniquet as it may cause gangrenous limbs. All these are not to be done. But yes, in hospital settings, suppose the person has reached well within time, or if there is a qualified medical personnel available near the house of the victim. Now, what you can do is you can use a pressure monitored wrap called Sutherland wrap. And this pressure monitored wrap called Sutherland wraps, they are utilized at a pressure of about 55 millimeter of mercury. Why? Because at this pressure, there is blockage of only lymphatics and superficial veins. So lymphatic and superficial veins, they are obstructed. So my venom spread is mainly through these channels. So they have been obstructed. But at this pressure, deeper veins and major arteries, they won't be obstructed. So my limb supply won't be affected. So here in this question, this is a simple question. Huh? All of you must have made it correct. Only two things are correct here. And they give you something like option A, B, C are true, A, B, C, D are true, something like that, na, to pick. So we should know the correct thing, and yes, we can approach our answer nicely. Question was given in option, na, like option A, only A, B, C are true, something like this. Yes. So here B and C are true. This we know. All this is not to be done. And what is to be done? We have to do it right. This also we covered, na. R for reassurance, I for immobilize the brittle limb, GH for go to hospital immediately, and T for tell the doctor of any signs and symptoms of toxicity. So all this is given in this MOHFW guidelines. This is a 65-page PDF, and we have covered the gist of this PDF so as to solve any such questions. And here comes one question from that guidelines. Chalo. This was again a simple one. Huge tragedies due to consumption of. बताओ इसका आंसर बताओ. Itna tough question. This is the toughest question. This was the toughest question from FA. Whose tragedy? Any tragedy in relation to consumption of illicit liquor. Illicit liquor. कच्ची शराब, देशी शराब, हिंदी में बोलते हैं, इंग्लिश में illicit liquor is due to methanol. And whose tragedy or consumption of illicit liquor leads to damage of optic nerves. They are in love with optic nerves. Why? Because this methanol, on getting metabolized by alcohol dehydrogenase, first of all forms formaldehyde. When aldehyde dehydrogenase acts, now what is formed is formic acid, and it is this formic acid which is in love with optic nerves, and this is also in love with our GIT system and our brain centers. So yes, it is highly toxic to vital brain centers. It will lead to intense abdominal pain. It will lead to necrosis of basal ganglia centers like putamen and globus pallidus, and it will lead to damage of optic nerves, irreversible damage leading to bilateral blindness. So usually people lose their vision. They become bilaterally blind and finally they die due to brain centers getting affected. So here the correct answer. And previous question was methanol poisoning mainly occurs due to which of the following? There the answer goes with formic acid. This is the agent which leads to, this is the metabolite. Next one. A person working in matchstick industry was having multiple discharging sinuses of jaw. What is the likely cause of poisoning? Here the correct answer goes with phosphorus. And we know in matchstick industry, phosphorus has got a uses. Phosphorus has got a uses. And we know phosphorus is of red variety and yellow variety, yellow or white variety. Red one is non-toxic, which is present in matchboxes. This we read now. But there are some manufacturing industries, matchmaking industries, to make money. They use yellow phosphorus too, which is the toxic variety. So yes, if the person gets into contact with the toxic variety, he can, over a period of time, he will become a case of chronic phosphorus poisoning. And this chronic phosphorus poisoning can lead to osteomyelitis of mandible bone, which is also called as phossy jaw, glass jaw, or Lucifer's jaw. And this osteomyelitis of mandible means infection has occurred, will lead to multiple discharging sinuses. This is what is called phossy jaw, glass jaw, or Lucifer's jaw. These are the words used to determine this mandibular osteonecrosis. Correct? Na? So this was also a simple question. I hope all of you have marked it correctly. गलत तो नहीं किया? Let me have some water. अब आया ये इंजरी इमेज बेस्ड क्वेश्चंस थे ना सेकेंड हाफ में. These were the two image based questions. One question was this one. They showed you an image with some injury over forehead, and recently I came to know कि इसमें कुछ history बना के दिया हुआ था that some people have bought blunt weapon and sharp edge weapon, both type of weapon, and they have attacked a person, and this is the injury over the body of the person, and they showed you the injuries over the scalp area. This was the area of concern. Correct, hai na? So what will be the correct answer here? This was a question which was asked in May 2022 NEET PG exams, almost. So this goes with incised looking laceration, also called as split laceration. Split laceration. Because the margins are irregular, and because there are tissue bridges between the two edges, something, our image cannot be the exact image. This is just a representation. So injury over scalp goes with, acha, crushing of the bulb of hairs was also mentioned. Thank you Chandu, thank you. तब तो क्लियर हो गया ना कि लैसरेटेड वुंड है, इंसाइज्ड वुंड ऑप्शन में ही नहीं हो सकता. चॉप वुंड मत सोचो, अवल्जन की तरफ मत सोचो अगर इंजरी ऐसा है तो. इफ देयर इज नो फ्लैप, how can you mark it as avulsion? So by ruling out option you can solve the question directly also. Areas like scalp and shin, here a bony structure is just beneath the skin, so we get splits in the skin due to the tussle of the soft tissues between the weapon and the underlying bony structure. In previous session of INI-CET they asked the mechanism of split laceration. Here they have formulated an image based question. Okay, crushing of hair bulb was written, then that is a very, this is again a simple question. Crushing of hair bulb. So this is split laceration, also called as incised looking lacerated. Another name for incised looking lacerated. I think the area which was shown in the actual exam image was this area, na? Vertex area, midline forehead. Now identify the finding in image. This also we covered in our classes, na? All the types of abrasion, and we know ligature mark, चाहे वो hanging का case हो or it is a case of ligature strangulation. Ligature mark is which type of abrasion? Due to sustained pressure for long duration, pressure abrasions occur. The best answer goes with pressure abrasion. This is also a simple question. गलत तो नहीं किया इसको? गलत तो नहीं किया? Imprint abrasion is also called contact abrasion or impact abrasion. Due to sudden impact of a moving vehicle, imprint abrasions can occur, or impact abrasion. Due to hard contact gunshots, muzzle imprint abrasions can occur. Those are imprint abrasion. Ligature mark is due to sustained pressure for long duration. Duration यहाँ ज़्यादा होता है. इसीलिए आपको एक ग्रूव्ड लाइगेचर मार्क दिखाया हुआ था ना इमेज में, telling you the fact that yes, the pressure was for prolonged duration, think towards pressure abrasion. A pattern was not visible. If you see na, if you see ligature mark showing you a pattern like this, suppose this is the person, this is the person, okay, this is the neck, and over the neck I say that the ligature mark was in such a manner, but the image which was shown to you was like this. It was a grooved ligature mark which was shown. There was no pattern which was shown. If pattern is an option and you are getting a pattern of the ligature mark, yes, then go with pattern abrasion. But here the answer goes with pressure abrasion. Correct है ना? हाँ, imprint abrasion में वो सब आ जाते हैं ना, tire abrasions and all. Tire abrasions, headlight rim abrasions, then your radiator grill abrasions. Pressure abrasion का और important example बताओ, other than ligature mark, teeth bite mark. Teeth bite mark. Another very important example is teeth bite. Due to sustained pressure by teeth, yes, teeth bite mark abrasions can occur. They are a sort of pressure abrasion for us. Pattern abrasion is basically a combination of impact and pressure. This was the beautiful question. This was the most beautiful question from FM. भूले नहीं, एग्जामिनर भूले नहीं कि ये भी टॉपिक बचा हुआ है. Finally it was asked, and the way of asking was unique. In one column they gave you 4 perversions. In another column they wanted to know whether you know the details of these perversions or not. आ गया ना finally question. This is a fascinating topic. Question आते हैं. तो इसका करेक्ट आंसर क्या हो जाएगा? Frottirism goes with rubbing of private parts. Eonism is also called as transvestism or cross-dressing. Cross-dressing. Wearing clothes of opposite gender when that is giving sexual gratification. तो यहाँ पर नंबर 3 लिख सकते हैं. Necrophilia is sexual intercourse with dead bodies. यहाँ 2 लिख दो. Exhibitionism is display of private parts in public. तो 4 3 2 1 खोज लो. 4 3 2 1 किधर है? ऑप्शन बी goes as your correct answer without any doubt. ये भी सिंपल था, बहुत सिंपल था. Transvestism is also called eonism or cross dressing. Exhibitionism, frottirism, इनके डिटेल्स हमें पता है. ऑप्शन बी इज द करेक्ट आंसर. So how was the FM paper? Baby paper? अच्छा था ना? But yes, we need to cover this subject nicely. अब देखा आपने इंपॉर्टेंस देख रहे सब्जेक्ट का. Out of 200 MCQs, you got about 12 MCQs in each session, 12 to 13. In one first session 13, in second session 12. So around about 25 MCQs. So you need to cover the subject completely, and very good subject na. You revise the complete subject in 2 to 3 hours and your 12 marks are nowhere gone. Law में तो कुछ change नहीं होगा ना. If something is like this, if eonism is wearing clothes of opposite gender, it will remain throughout na. It won't change all of a sudden. So this is a scoring subject, not to be left subject. And in future exams you will see 13 to 14 questions. 12 to 13 से बढ़ के ये 14 15 टच होएगा. And it is a good thing. It is a good thing from student point of view na. From a small subject, if you are getting more questions, easy questions with 100% accuracy, 100% speed, you will be able to solve the questions. हमारा target क्या है? We have to achieve a good rank. That is the whole target of DBMCI and eGurukul too na, to give you all a very good rank in your exams so that you settle yourself. अब देखो settle तो होते हैं कि नहीं पता नहीं, but हाँ, if you get a good rank, you feel very happy ना that your hard work has paid finally. So anything else which you want to add is most welcome. Any other question which is left or which you think has not been discussed, just let me know. Ashby's rule was there in criminal. Ashby's rule instead of Ashley's rule ना, कोई बात नहीं, ठीक है. एशबीज रूल करके कोई लॉ ऑफ इंसैनिटी नहीं होता। लॉ ऑफ इंसैनिटी तो हम लोगों ने रिवाइज किया ना, इररेजिस्टिबल इंपल्स टेस्ट होता है आईआईटी। देन योर अनदर वन इज न्यू हैम्पशायर डॉक्ट्रिन, then we have Durham's rule, we have Curran's rule, we have McNaughton's rule, and then we have एक लास्ट में अमेरिकन लॉ इंस्टीट्यूट टेस्ट, ALI टेस्ट. These are the important laws of insanity across world. Any other question which you can recall, which anyone can recall? Just let me know in the live chat window. So be ready for revision in the power course. Power course करके launch हो रहा है ना, offline and online both the mechanisms. अगर offline कर सको that is very good. If not possible, if you are in a peripheral center, you can utilize the online mechanism, online or offline mechanism across 9 cities. Offline batches will be there and we'll be covering the subjects, all the 19 subjects in a span of about 30 days, about 1 month. So you can take benefit if you need a revision जो कि आपसे नहीं हो रहा. We are there to help you achieve good tracks. और बताओ, any other question? चलो तो सेशन एंड करें. So all my best wishes to all. So out of 13 questions in the first session, 12 questions in the second session, I hope many people have got 100 out of 100. If at all there are few mistakes, not to worry. Mistakes सबसे होते हैं, but हाँ ज्यादा नहीं होने चाहिए. उन mistakes को कम करना है so as to get good ranks ना. That is the whole story of exams. So taking into consideration कि और कोई question नहीं थे, so we can end the session ना. So it was good interaction with you all. अब थोड़ा रिलैक्स होके एक दो दिन कीप ऑन वर्किंग. अपने आप को ना इतना भी रिलैक्स नहीं कर लेना है कि फिर भूलने लग जाओ. स्टार्ट वर्किंग फॉर योर अपकमिंग नीट पीजी एग्जाम. इसमें मान लो रैंक कैसा भी आए, यू विल बी इन अ पोजीशन टू गिव द नीट पीजी एग्जाम. सो अभी टाइम नहीं वेस्ट करना है, एक दो दिन रिलैक्स होके एंड देन स्टार्ट अप विदाउट एनी डिले. नहीं तो एक बार वो मोमेंटम ब्रेक होता है ना, तो हमारे ब्रेन को बहुत गंदी आदत है, जो सबसे इजी रीचेबल चीज होता है ना वो करना चाहता है. तो रिलैक्स नहीं होना है, मोमेंटम को ब्रेक नहीं करना है, मोमेंटम मेंटेन रखना है टिल यू अचीव जिसके लिए आप पढ़ रहे. चलो देन, बाय बाय. बाय बाय.